Hi, it's Sonia and Rachel. Back for another webinar on methylation. So if you haven't seen our other two, Rachel did one on women's health and the research in around methylation and men's health. And today we're going to talk about pediatric health. Rachel's our newest team member at the Natural Care Clinic, and she's a graduate of the Canadian College of Naturopathic Medicine and has a BSc in biology and is just overall brilliant. So we're really lucky and happy to have her. So do you want to get started and tell us a little bit more about how methylation impacts our pediatric patients? And I'll maybe jump in with some autism information because I've been known to know a little bit about that.
Yeah, for sure. So we're first just going to talk about the overall conditions with methylation dysfunction in pediatrics. So it's often seen in ADHD, ADD, autism, OCD, developmental delay, failure to thrive, epilepsy, seizures, hypotonia, and poor sleeping habits. So I'm going to get into a bit of those for some of the conditions. So, like you said, this is our third part of the series. In the other two parts, we talk extensively about methylation and how it impacts the body, and when there is dysregulation, it can affect, the processing of homocysteine going back to methionine, and the downstream effects, without properly methylating B12 or folate. So first, we're going to go into autism spectrum disorder or autism. So these are the SNPs in autism that are usually found when there's a methylation impairment. Studies have found that when there is a methylation impairment, it can lead to impaired gut motility. 90% of serotonin is made in the gut, so that's usually impaired. And slow motility leads to fecal loading and impaired absorption. I know Sonia's like the expert in autism, so if you have anything to add with autism.
Well, I think the problem with methylation is, right, that 90% of kids with autism have the methylation issue. So then they're mostly going to have downstream issues with the other pathways. So methylation is responsible for making carnitine, which shuttles fats into the cells, contributing to that slow motility, but also reducing the fat that can get into the brain. And I always say to patients, like, we can help your child make more brain chemicals like serotonin and dopamine, and then we need to package them in fat. And like you said, the brain requires, later on you'll talk about the myelination and the nervous system. Like, methylation governs our brain function, so it's a really big problem if it's not functioning properly and has a lot of downstream negative impacts. So fixing methylation opens up hundreds of opportunities developmentally.
Exactly. So yeah, like you just said, vitamin B12 levels in the brain are significantly decreased in children with autism. So that's why we find it so important to give them methyl B12 in order to help them process properly in the brain. And then now we're going to move into ADHD. So studies have found that vitamin B12 deficiency may be one of the factors that worsen the symptoms of ADHD. This can be due to its role in neurotransmitter synthesis and functioning, but also the myelination of spinal cord and brain. So myelination is basically the fatty white matter around your neurons, which help make transmission go faster. So if there's issues in making myelin sheaths, then you're going to have issues with like neurological functioning. So vitamin B12 deficiencies is associated with learning difficulties, hyperactivity, impulsivity, oppositionality symptoms in children with ADHD.
One of the things too with kids with ADHD is because of their problems with dopamine, they have a lot of anticipatory anxiety. So I've found over the years that I haven't been as successful getting kids with that diagnosis onto things like methyl B12 injections because they're too stressed to take them. And so transdermal is always an option. And I think years ago, we were trying out different transdermals, which is a cream that goes on the skin, and we just weren't seeing success. B12 injections are 100% absorbed, and the oral is 5%. And so because the brain is all fat, we're trying to solve this problem of the B12 staying in the body long enough to be effective. So we started working with a pharmacy, actually owned by two sisters, which is interesting because, Chris and I work at the Natural Care Clinic, although she's my forever boss, as everyone knows. But And so they actually have a transdermal that seems to be working. They have a different carrier oil and kind of explained to us that if they can get it absorbed with this oil, it's about 15% effective. So I've had more success with that over the last few years with kids with ADHD. So if you want to be trying methylation, but B12 injections may not be a good fit for your kid, Rachel can absolutely help with, with your one injections or not. But the transdermal is definitely an option in the last few years that's been making a difference.
That's amazing.
Yeah.
Okay, so then the next condition that we're going to discuss is developmental delay. Studies have found that low maternal B12 levels are associated with developmental delay. So during pregnancy, you would want the pregnant mother to be, taking in her prenatal vitamins that include B12. Vitamin B12 deficiency is also associated with neuronal regression and developmental delay, and it's seen in conditions such as failure to thrive, issues with gross motor skills, speech and language delay. So all of those kind of things are affected. So not only do we want to make sure that the children are getting vitamin B12, but also during pregnancy, you want to make sure that you are giving B12 to the mothers as well.
Yeah, absolutely. Especially when you look at these things like motor skills, as a parent of a child who has had delays, naturopathic doctors can help so much with kids who do have fine and gross motor delays. I do think OT and PT are extremely important, but if your body doesn't have enough energy, those exercises are going to have less effect. So if you improve methylation, you're improving the production of creatine, and creatine, as you guys might know, it puts energy into muscles. So if you have gross motor delays, something like creatine, something like B12 or methylation support can make a huge difference in how effective your therapies are. So kids with global developmental delay, or kids with cerebral palsy, or kids with unspecified or undiagnosed delays, and even the fine motor, when you look at the fine motor piece, a lot of kids with ADHD, for example, they go into elementary school and they're having trouble writing, right? Naturopathic medicine can help that by increasing the amount of energy your child's body is producing. It really helps with their ability to hold, the pen or pencil and crayon. Delays at school are really stressful. So that's why a little bit of extra support with diet and vitamins can make a massive difference. Because
Mhm.
these families are spending a lot of money on therapies. So to get the best out of them, it's kind of like if you're going to the gym, but you don't have the right diet or vitamins, right? You're getting less out of that.
Yeah, and I think it's just great, like being at this clinic and just learning how we approach things in a kind of biomedical approach. So if you're noticing, okay, they're vitamin B12 deficient and you're, having gross motor delay, also looking at their creatine and just making sure, everything is working together synergistically.
Yeah, absolutely.
So then the next condition we're looking at is OCD, or obsessive compulsive disorder. So studies have found that higher homocysteine levels and vitamin B12 or folate deficiency are correlated with OCD. So I did add in a study where they looked at the role of vitamin B12, folic acid, and vitamin D in pediatric OCD. This child, they found that lower levels of vitamin B12 and vitamin D causes a high amount of homocysteine, or also known as homocystinuria, and they measured this on the Yale-Brown Obsessive Compulsive Scale. So that's how they quantitatively tracked and saw that, higher levels of vitamin B12, you're less likely to have pediatric OCD.
It's interesting. I mean, OCD, if you see the physicians, typically they'll give an SSRI, like a drug to improve serotonin in your bloodstream. So B12 and folic acid, as you know, Rachel, but it helps to make serotonin. So you're kind of solving the root issue. But that's interesting. I didn't really think of vitamin D in there. I often think of N-acetylcysteine because they did that research at Stanford that showed that N-acetylcysteine would help reduce obsessive behaviors. And yeah, that's I actually see physicians recommending vitamins more and more for kids. So I think, toxicity depletes B12, like air pollution, pesticides, propionic acid within the food supply, heavy metals. If you're living in our modern world, I think you could make the case that there's a lot of health concerns that require B12 to improve.
Yeah, I agree. And then the next condition we are going to look at is seizure disorders. So here, this is another case study. It was a 3.5-year-old girl with seizures and epileptic spasms, and she was exclusively breastfed as an infant, and her mother had vitamin B12 levels. So they both were given intramuscular vitamin B12 injections. The child was also given another medication, and the seizure stopped. So not only was a low vitamin B12 levels in the child, but also in the mother. So I always like to, make sure that everybody is having an optimal amount of B12 levels. And this study just, reinforced that.
Absolutely. What is it? 20% of kids diagnosed with autism also have a seizure disorder, but a lot of them have seizure-like activity. And so I think B12 deficiency is part of that. And, obviously naturopathic doctors aren't frontline or primary care for seizures, but we can definitely help improve cellular function. Gut health is huge in seizure activity, sleep, which relates, as Rachel's going to talk about, to the B12 and the methylation cycle. So optimizing your child's biochemistry and physiology helps their medications work better and reduces symptoms wherever they're having them. So, we're talking about the brain today in kids, but hopefully throughout our webinars, you'll realize that the methylation cycle is critical to every single cell and every single organ system in our body.
Yeah, I agree. Like just like in the previous presentations that we had, we talked about how SAMe downregulates 200 pathways or over 200 pathways. So it's so important to make sure that, we are fixing the root cause, and that's the whole point of naturopathic medicine.
Yeah, and SAMe can be great for refractory depression, right? We've got a lot of, unfortunately, a pandemic or catastrophe of pediatric mental health issues, so anxiety, depression, self-harm. I mean, this is a time for kids where I think they really, really could benefit from this type of support, in addition to all the other supports they need.
I agree. So we're now going to look at lab tests. They are pretty more similar than the other two. So we look at blood work, look at, insulin-like growth factors, their blood sugar levels, cholesterol, ferritin, markers of inflammation, creatine. Like we said before, we want to look at the whole picture, make sure that, if you're concerned about gross, motor functioning, you want to look at those, okay, is creatinine something that is affected? We do look at B12, but we want to look at all the other parts that play a role in methylation. Like we said before, naturopathic doctors can't requisition genetic tests, but we can read SNPs. So that's something that our patients sometimes bring in their genetic work, and we kind of help discuss and interpret those. And then additional testing, or the O test, SIBO test. We want to look at the gut microbiome, make sure that the gut is working well and you don't have overgrowth. A stool analysis and a trauma test.
Yeah, and we actually, when we're talking about the oat here, many of you will know the oat from a certain company. Great Plains Lab turned into Mosaic, and they have that really comprehensive organic acid test, which is a wonderful test. But there's another company that we work with that's amazing. They're an excellent lab. They will just do the neurotransmitters, so it is a less costly test. So I love the oat, both of them, but the advantage of the one that we do through US Biotech is that it's, I think, $200 less if you want to just look at things like serotonin, dopamine, your excitable neurotransmitters like glutamate. That's, that low serotonin, low dopamine, high glutamate leads to so many of the problems that we see, including things like tics and OCD and the behaviors we see in autism and ADHD. So that's a great one. I often think the other time I really like when parents can consider investing in that test is if the child has oppositional defiant disorder, because it's so hard to understand why a child would say no to everything, but usually they have really, really low serotonin. And, biologically, that's the easiest way for them to manage, is to say no. So getting that serotonin up in ODD, but also kids with ADHD almost always have a little bit of ODD. They don't always get the double or dual diagnosis, but this stuff can really change quality of life. I can say that as a naturopathic doctor, I can say that as a mom, but when my kids get methylation support, they're the best versions of themselves. Like even my daughter was talking about that this morning. And then the last thing I wanted to add is just I'm seeing a lot of cholesterol problems in kids, not high cholesterol, low cholesterol. Methylation is needed to make cholesterol, and cholesterol is the king or queen of the fats. And it's needed to actually allow you to have vitamin D produced. So if you do blood work and you have low ferritin, low cholesterol, low vitamin D, you may have methylation issues, may have motility issues, or both. And the brain needs cholesterol. 25% of the body's cholesterol, or 25% of the body's cholesterol is in the brain. So
Mhm,
cholesterol allows the brain to function by allowing fluidity, right?
mhm.
And cholesterol, if there's not enough of it, our cell membranes get really like hard and they don't function as well. So kids need optimal cholesterol, and I have seen a lot more low cholesterol or low normal cholesterol in the kids that we're testing. So blood testing in kids isn't easy, but it can be very helpful.
Yeah, yeah, definitely not easy.
And some of the tests are stool and urine, so those are not your favorite thing to collect, but a little bit easier.
And then our last page would be just the treatment recommendations that we would consider as, in naturopathic medicine. So diet, removing grains, so gluten-free, cake-free diets, paleo diets. Those are a lot of the mainstays that we use in pediatrics, increasing vegetable intake, especially leafy greens and cruciferous vegetables. Then supplements, a lot of them are similar to what we said in the previous two presentations, but we're looking at all the things that will improve methylation, SAMe, B12, folate or folinic acid, um, creatine, zinc, all of those different type of things. And then, vitamin, um, the B vitamins. So methyl B12, like we said before, we can do injections in children, but if it's difficult, transdermal or supplements, but the absorption rate is the best in injections, but we can do the other two forms. And then, B12, vitamin B6 as well.
Yeah, and I think like I've been practicing for 20 years, and those of you watching this who've known me, I'm pretty crazy about the diet. Like I'm pretty strict or neurotic or crazy or whatever word you want to sub in. But I do that because I think it is the best for kids if you can get there. But I think the nice thing about having Rachel is that I think she has a much more tempered, like consistent and persistent, but not just like all or nothing. And I've really appreciated chatting with her about that because I think it's going to help a lot of families. Diet's important, but sometimes it can take a year to change a child's diet. And there are also medical concerns in there in around picky or fussy eating, like the digestive issues that you can test, what's living in the gut. Do the kids have fecal loading? Do they have low zinc? As zinc is a big one in terms of appetite, but I think picky eating and appetite sometimes stops people from seeing me because I'm a bit of a lunatic. But there is other approaches, and I think kids can benefit whether you do everything all at once or you take a very consistent step-by-step approach forward, as long as you're continuing to move forward with the help of someone who can kind of plan that out or navigate that strategy for you. And then the other thing I was going to say about supplements is just, I don't know how you feel, Rachel, but in the last 3 or 4 years, there are so many more supplements that are kid friendly.
Yeah.
Like 20 years ago, trying to get kids to take these disgusting supplements was just, there was no other alternative. But now I'd love to hear your thoughts on that because I just find there's so many better options.
Yeah, I do agree. I mean, I think the forms in which they're coming in have been a lot more creative. For example, omega-3 fish oils, they come in not only just supplements now, but they come in, smoothie formulas, they come in, liquids that are more palatable for kids. So I have noticed, supplements have been coming more and more palatable. I mean, even the clinic just received the Alpha GPC and
I have
and
it all around here at all times. I love it.
and even myself, I would say I'm pretty picky when it comes to supplements, and I just take a swing at it, and it's really, really friendly for the brain. We're using it for ADHD, ADD, autism, brain functioning. So that's another thing that we did put on the list, but it's also been very, awesome. I've noticed it even with myself that I don't have any like neurotypical behaviors. I've noticed that my brain has been functioning a lot better with it. So, you know, supplements have really improved over these couple of years.
I'm so glad you mentioned that because alpha GPC comes in a little bottle kind of like this, and you make sure you shake it before, and then you take 1 or 2 dropperfuls once or twice a day. And depending if you're a child or adult, but you can take more, it's extremely safe. And so when we took it in the clinic, my brain calmed right down. But I was laser focused. And it's a supplement for me. I've never had a supplement work that quickly. I've had lots of supplements work. I love being a naturopath. I love using naturopathic treatments, but I've never had a supplement work that quickly. And so I talked to my kids about it, and my oldest son, who has ADHD and pandas, he's like, I want to try it. I want to try it, but it was on back order and it was Christmas. So finally it came in the first week. And so we were so excited to try it. And so he took it and he texted me. He's like, Mom, my brain is so calm. And he said to me, it's like I almost can't worry about the things that I would usually worry about. And he's focusing, like he did a bunch of work that was due. And it's just been really, really neat to see. And then I gave it to our little guy who has autism and ADHD. Because he was asking, he's like, what is the thing you're talking about? What's this dropper? So he's like, can I try it? I said, yeah, for sure. So we give it to him. And he's always kind of bouncing around when we're watching movies. And he wants to play chess and wants to play with a little mini basketball net. And he's our youngest. We're like, just sit down, watch the movie. So he takes it and I give him about 10, 15 minutes. I'm like, so how do you feel? He's like, yeah, I don't feel different, but I'm really into this movie for some reason. So I kind of looked at the other 2 kids, and so then he's like, what's it for? I'm like, it's for focus. He's like, you have to let me play a chess game because he's really into chess. So he did his chess game and he did it really well. And then he had a chess tournament. So I sent him some to school before his chess tournament, which he won, which was fun. But it's been really interesting. Even my daughter, who's dyslexic, she's finding it really helpful. And so I also think anxiety, although I haven't had a ton of kids take it for anxiety, but I think there's research to support the use for anxiety, right?
Yes, so there are reports that they've used it in children for anxiety, and it's improved anxiety. Alpha GPC, crosses the blood-brain barrier, so it really works directly in improving the brain. So it is a helpful tool for anxiety in children.
And so I've taken it too, and as a parent of kids with different developmental stuff, right? And I'm lucky enough that they let us share our stories and our journey, and it's stressful. So for the moms and dads out there, a lot of people have a lot of trauma or stress or worries, or prone to getting really stressed out because things have been so stressful. The peaks and the valleys of this journey, and I've actually found myself a lot less likely to panic, when someone's going to get hurt or something's going to happen or someone's, struggling with something. I'm not kind of getting to that point where I would stress wise before. And, I just think it's important for parents to be thinking about their brain health and their well-being. And I've had lots of parents over the years on B12 injections or recommended taking a B complex. I mean, methylation is just so critical to health. And the methylation cycle does eventually make alpha glycerylphosphocholine, the alpha GPC that we're talking about, but it also has to make so many other things that sometimes if you choose a downstream product like carnitine, creatine, glutathione, alpha GPC, then the methylation support can go to helping all those other pathways. So it's been a neat, and it tastes good, right? It's just been easy for compliance too.
It's so nice.
Yeah. Yeah. Finally, something that doesn't taste disgusting. Surprisingly, I'm talking about it.
And so that's it for us today. And then this is just if you have any questions. We are going to be doing a pediatric series starting hopefully next week. So we're going to be talking more about pediatric health and how we can improve it with naturopathic medicine.
Awesome. Well, see you guys next time. Take care.
Thank you.